come on in and join us in the webinar room. So great to have you here today. We are going to wait just a few minutes to get started because I want to make sure that everybody who is going to join us today has joined us before we get started. But while we wait for those few minutes, first, oh, it looks like Dave has already said hello. Hello from Michigan. Hi, Dave. So please check in the chat. Let us know your name and where you are logging in from so we can say hello to you. Hi, Chadwick, also from Michigan. Fantastic. And then as well, I just really quickly, my name is Lisa Shomo. I'm head of community here at Viome. I'm always thrilled to be able to continue conversations with our Viome users and lookers here and online. And since I've brought it up, I'd like to extend an invite for everyone to come to the Viome community over on Facebook. I'm going to pop up a link for you guys, and it'll pop up over your presentation deck, but don't worry, you can always close it down by clicking that little close button underneath. So please come over and join us on the community. You do have to answer a couple questions and accept the guidelines, but then I will let you in as soon as possible, and then you can join in the conversation. So welcome to all again. All right, so let's see here. Who is logging in here? We have Priya and Puneet and Renee. Dallas, wow, Virginia and Toronto, and Lee from California. Hi, Jim from North Carolina, and Dave, rather it was X. Kevin, it was Kevin. Hi from Florida. Hello, and then another Californian, Michael, and then Patricia. Thank you for joining us, Patricia, for this webinar. I think you're going to get some excellent information out of it. So let's see, we're at 11:03. I think we can wait like a couple, like 30 seconds more. I think that'll be fine. Hillary, howdy from Washington. Hello, we're neighbors. All of us are in the Pacific Northwest. Sometimes we have somebody from New York or the Midwest, but we're all here in the greater Seattle area. And hello to everybody who is near us. And I think that's okay. I think it's good to get started here. People will come in, and that is just fine. They can join in. We can get started. June is Men's Health Month, and I hope everybody who celebrated on Sunday had a wonderful Father's Day. I have two males in my life, my husband and my son, and I'm very interested in helping them optimize their health, and both mental and physical, as well as their longevity. And of course, a key to this is personalized precision nutrition that is right for your biology. But that is just one of the keys. So I have two wonderful, as you can see, wonderful individuals here with me today to talk about those keys that can help men and, of course, women everywhere lead healthier lives. First, I'll introduce a face over on this side that most of you probably know, Dr. Grant Antoine, member of our clinical nutrition team here at Viome. Hello, Grant.
Hello. Thank you, Lisa. Happy to be here. Also thrilled that we have a special guest today.
And I would love for you to introduce him.
Absolutely. So Jorge Tovar is with us. Jorge has his master's in counseling psychology. He's a licensed mental health counselor. He has vast experience in both one-on-one and group therapy sessions where he facilitates personal growth by helping people heal from their past and find fulfillment in their present, right? He served as an educator, but currently he's working as a clinical manager at Two Chairs Seattle, where he oversees clinical operations there and supports clinicians in both their personal growth and their professional growth. So Jorge, thanks for joining us today, man.
Hey, Dr. Grant. Hey, Lisa. Thanks. Welcome, everybody. Saying hello from Seattle. Really happy to be here.
Absolutely. So why are we here? We mentioned Men's Health Month, right? It's an opportunity always to highlight that men can and should live longer and healthier lives, right? Unfortunately, when we look at the numbers, we see some disparities, right? There's opportunities, there's work to do. Especially when it comes between men and women. Despite all the biases there are that have been baked into clinical research over the years, into medicine, that traditionally overemphasize males, men still lag behind women in terms of mortality and morbidity. All that means is men are living shorter lives with more disease, right? What's going on here? The disparities become even greater when we look at mental health, right down at the bottom. Men have a 3 to 4 time greater suicide rate than women. What's going on, right? There are some well-known barriers that affect all populations when it comes to accessing quality healthcare. Financial constraints, absolutely. Whether you have insurance or not, insurance can be expensive. Healthcare, we all know the cost of healthcare in America is outrageous. Even with insurance, deductibles, copays. There's access issues, right? Are you in a rural community where you have limited access? Maybe there's no specialists available in your area. Maybe transportation's an issue for you. It's limited or unreliable. Cultural factors. Are there language barriers that are keeping you or your loved ones from seeking help? Stigmas, right, around certain conditions, especially mental health, as you're going to hear that over and over today as our focus. But those cultural beliefs might influence, how we seek care or how proactive we are in our care. And then just healthcare as a whole, the system, it's complex, and navigating that system, it can be confusing. Paperwork, appointment scheduling, understanding your benefits if you have insurance. So like these barriers, they disproportionately affect low-income communities, racial, ethnic minorities, immigrants, rural communities. But today we want to zoom in specifically on men, because as we start to look in men specifically, certain trends start to emerge, right? And in 2019, the Cleveland Clinic did this great study, the Mention It study. And they found some interesting things, right? So 72% of men would rather do household chores, mow the lawn, do the dishes, than go to the doctor. Almost 80% would rather go shopping with their partner than go see a doctor. Most aren't being honest with their doctors. Almost 50% are embarrassed when they speak with their physicians. Another almost 40%, they don't want to hear what they need because they don't want to implement any changes with their diet and lifestyle. Others, like almost 40%, they knew something was wrong, but they weren't ready to face it yet. They weren't ready to hear that diagnosis. Many of them are being told that, hey, men don't complain about health-related issues. And another like staggering number, so 80% of men, they try to stay healthy and live longer for their loved ones, right? For their friends and family who rely on them. But only 50% are engaging in preventative care and reaching out to their doctors. So when it comes to men, there's more to the story than just, we always hear men just engage in more riskier behavior, right? Men drink more, they're doing dumb things, especially when they get together on the weekends. But we don't think that's good enough. And that's why we brought in Jorge today. We want to do a little digging, a little probing. And it turns out that mental health is a huge barrier to self-care for men. And hopefully today we can provide another perspective from which the men in the audience or the partners in the audience that have those men they care about at home, we can start to recognize these barriers to men's health. And hopefully you walk away today with some insights and some tools to break through those barriers, right? And I don't know if you saw the title, but man up. Like we want to redefine what it means to man up, right? It should no longer mean to grin and bear it alone. To suck it up, right? I get this image of like the 1980s tough guy, the lone wolf, the Arnold Schwarzenegger or the Stallone coming in and battling an army by himself. Like those images, they're long gone. We need to put those to rest, and really, like, we need to have the balls to take a look within, to do that work that needs to be done so we can be our best selves. Brother, father, husband. We need strong, healthy men to be leaders in our community just as much as we need strong, healthy women, right? We're in this together, and we need to work together to be our best selves. So that's my soapbox, and I'll step down. I'll let Jorge's going to introduce a little bit more of these specific barriers to men that men experience, and I even think he's got a pull for us. But Jorge, thanks for joining us. Jump in.
Thanks, Grant. Just to start us out, we're going to start out with a poll. But before you go and answer the poll, I just want to preface a little bit. We're going to show you the stats for this question and what we're asking. But I'm going to encourage all of you, the men who take this poll, to man up and redefining what that means. We're asking y'all, to be honest. Take a second. And this, I'm asking you to not answer how you normally answer. So before you get into the poll, and we'll break it down, we'll talk about it a little more. I just wanted to take a pause for a second and say, man up is being vulnerable, and not being tough and holding it all in. So it's just one question. Take a second to answer it, and
which is even harder to do, right? It's hard to be vulnerable, to open yourself up, and it's much easier to put up the shields and be guarded, right? And that's what we're used to. That's what we're accustomed to, right? So it really is a challenge, right?
Yeah, no, I mean, and from my experience, when I talk about men or talking about mental health issues or men's health issues in general, with men, it's like it's almost like breaking the rules. Like, what are you doing? Why are you asking me that? Why are we talking about this? So yeah, it's absolutely something that we're hoping to at least today introduce, redefining, talking about. You know, it's been talked about before for sure. We're not saying anything new, but I think it's important. Like you said, we can and should be living longer, and yeah. So thank you for those of you who have taken a second to answer in the poll. Like I said, we'll come back and look at those numbers here in a little bit. Yeah. So let's get into it a little bit. Yeah. What are barriers for men? Masculinity, right? In general, men are socialized to be tough, show no feelings. We must be strong, no signs of weakness. That's the thing. We must be the provider for the family. A provider provides. That a provider does not need, right? It's very simple, but it's in the language. It's embedded in how we are supposed to be as men. Influences to men's health. There's individual and societal influences. Your environmental, familial, socioeconomic status, cultural influences. All these things affect how men cope with health issues. Environmental. This is both environmental in which you were the environment in which you were raised, where feelings talked about openly, or what they minimized. We all feel like that from time to time. You'll get through it. But also the broader environment, as in your neighborhood, the part or side of town or city that you grew up in, or part of the country. Access to healthy foods like grocery stores versus fast food chains. All those things influence, right? Grant, you talked about the cultural piece. In some cultures, men work more. They keep busy to avoid depression, push through. Studies show that, particularly in Hispanic cultures, men deal with depression by working more, 2 jobs, 3 jobs. Whether that's longer hours, a second job, taking on extra projects at home, keeping busy is the status quo a lot of the time for men. All these different influences impact men's health, especially mental health, especially for men. Another barrier that we can't ignore is that it's really oftentimes it's unhealthy and unrealistic expectations or standards. The ideal of the perfect male, we've talked about this, Grant, or men's health being propagated, right? When you think of a men's health magazine, what's on there? I would be shocked if it's a therapist sitting there thinking, or if it's a man like having emotions, crying, right? A man tearful at his daughter's wedding. No, it's going to be rock hard abs, huge bicep.
No excuses.
Yeah, exactly. Tough. And some advertisement for an energy drink, I'm sure. So
yes,
because we need to do more. We need to keep going, right?
Yeah.
But again, I want to highlight this. It's unhealthy and it's unrealistic. We're not supposed to have needs. We're not supposed to need care. For like babies need their mamas. Men are men. We don't, right? And I know I'm speaking hyperbole, but it's still true. It's ingrained in us. It's there, whether we think that example out loud or not. Again, this unrealistic and unhealthy expectations that we are to provide. We're providers and we don't need. And one more barrier that I want to mention is communication. To generalize it, talking about feelings and problems is more acceptable for women than it is for men societally. A big component of that is shame. This is often a silent and powerful motivator. What we feel shame for, our insecurities, things we don't get to talk about, we're not allowed to talk about, we're not supposed to talk about. And that goes hand in hand with not being able to be vulnerable, right? Can we be vulnerable? Like even you, Grant, had to like remind me as we're talking about the poll, and I'm reminding folks to like, hey, let's be honest, let's take a second. And you're like, and it's tough to be vulnerable, right? Like we need that reminder. We do, and we need people in our lives that are going to help with that reminder. So it takes courage. That's what man up should mean, right? That it takes heart and it requires practice. There's a lot of miseducation or no education about talking about feelings for men. So to bring it back, brings us back full circle to masculinity. I'm not saying anything profound or new here. With all the barriers to men's health we just highlighted, our ideas of masculinity need to change.
Yeah, no, it's absolutely. And it's like there are filters, right? And you may or may not know that filter's there, as you're looking through your personal lens. And some people might have thicker filters, I guess I'll say, or stronger filters than others. So there's a spectrum here, but absolutely, I feel like this is something that touches on all things that men think, feel, do, right? There's always this unspoken pressure or sense of, I should be fulfilling some image. So what is your experience with these barriers that men experience?
Well, I mean, it's no surprise, right? What's one common thread in everything that we're talking about right now? We're talking about men's mental health. So I think we can't talk about this without talking about men having to have honest conversations and a self-assessment, being honest with ourselves. And to help with that, we've provided a self-care assessment for y'all to look at. I think Lisa will be sharing it with you all.
A great tool. Yeah.
Great tool. Grant and we did this the other day, and it's really interesting. I encourage you all to do it with someone close to you, someone you care about, and share. Just to go over that really briefly, that PDF for the self-care assessment. We're not looking for perfection here. We're just asking for honest answers. Take a second whenever you have time, go through it, see where you are. We'll come back to this assessment a little bit later and use it as an example as we try to set goals for ourselves. But we thought it would be a helpful tool for each of you to take a look at your self-care routines. And it breaks it down into several categories, physical self-care, psychological, emotional self-care, social self-care, spiritual self-care, professional self-care. And there's a pretty simple ranking system, but it's really interesting. And it should be helpful to get folks started.
Absolutely. I love it because it's so comprehensive, but it's so practical. Like it's almost seemingly like basic, but it's just so distilled maybe or approachable that it's great. And then for me personally, just my spiritual self-care and my social self-care like brought forward my key opportunities, right? And maybe I can set some goals there, but no, an excellent tool. Absolutely.
And as you take a look at it, it's a great way, like maybe you didn't think about how you are right now in all of these different situations. It's a good way to just, like you said, take a look and have everything on one sheet to be like, oh, okay, I'm not doing so bad, or, oh, that area could use a little help. So it's a great tool.
Yeah, I would agree. And even myself as a therapist going through it, I was surprised to see some of the rankings or where I land on. And what I really enjoy about it is that it's not just a screen with it also includes an area for you to star, like, oh, I really want to work on this specific thing. Like for me, I wasn't very surprised that my professional self-care was a little bit on the higher end because it's built into my work, right? We have continuing education. I'm a therapist. Like my work actually asks us to like take self-care at least 1 hour a week, a wellness hour somewhere in there, right? We advocate for therapy and talking through things. So my professional self-care is not surprisingly one of the highest on mine. But some simple, basic psychological, emotional self-care is like asking for help. That's always an area that's I'm aware of that I'm going to have to work on and continue to work with. So that's just a couple of small examples. Like I said, we'll come back and reference this when we get into some specific SMART goals.
Right there with you, buddy. that's why we're talking about this. Yeah.
Yeah, exactly. Yeah, so I'll come back to you, Grant, and we'll talk a little bit more about that as we get into it. Yeah, so let's look at this slide. I mean, 20%, the stigma, 20% of men in one survey say that there's a negative stigma around mental health. embarrassment. 29% of men in the same survey said that they were too embarrassed to speak about their mental health. Time off work, 52% of men in another study would be concerned about taking time off work. Pretty common thing I hear pretty often. Fear of employer, 46% of men in the same survey would be embarrassed or ashamed to tell their employer. So, which is why I wanted to take a look and see our audience here, right, and looking at the polls. Can we pull that up real quick?
Yeah, actually, if you click on polls on the right-hand side, you should be able to see them, and they are available. They're visible to the audience. So if everybody wants to click on polls, then you can see the results.
Oh, that's awesome. That's great. We're doing great, y'all. Everyone here looks like there's a pretty high percentage of being comfortable talking about mental health issues with a professional. That's great. That's obviously a little better than the norms as we read you the stats.
Yeah, I'm gonna call BS on this one a little bit.
Are we being tough right now?
That's happening. That's exactly the problem we're talking about. Like, look at all these great, open, vulnerable men in the room. Who knew there were so many out there? No, but yeah.
Yeah, what is that? Is that when you see these polls compared to the stats I just read? What are you thinking?
It's very interesting.
Right.
Yeah, this is the exact pattern that we're identifying.
Yeah. And no indictment, no shame, fellas. Thank you for participating. So let's get into it, right? First and foremost, literal mental health symptoms. We're going to talk a lot about things that we can do today and like skills and ways to get you started. But I can't skip over the fact that there is sometimes just mental health symptoms that there isn't a worksheet or like just keep going or a tough, pick yourself up by your bootstraps and push on. There are some times where we need medical help with symptoms like depression, anxiety, and then also low self-awareness. Depression and anxiety in men has increased, especially over the last 4 years.
Mm-hmm.
And men aren't talking about it. There's no substitute for mental health care. We have to start dealing with our depression, anxiety, and our mental health symptoms. And we struggle even to talk about it, let alone to say we need help with this or to identify that we have concerns to get support in any way, shape, or form. I'm not just talking about the doctor. I'm talking about telling my best friend. I am talking about talking to your doctor, but I'm also talking about whether we discuss it with our best friends, our friend group, our partners, our brother, our family, right? There's a lot of work for us to do and a lot of work for us to look inward. I think another area is lacking self-care and self-worth, right? Shameless plug here. Talk to a professional, talk to your doctor, talk to your psychiatrist, find yourself a therapist that you feel like you can talk to. I think that's one of the most important things about the work that I do is that it's very important that you find yourself a good match, that you find yourself a therapist that you feel comfortable talking to. And sometimes that takes 3 to 4 meetings before you know. So just an encouragement, a little plug there to give it a try and give it some time because it takes time.
And I would even say you don't have to have depression, anxiety, or these issues. Like everyone can benefit with working with a therapist, right? Whether it's with decision making, goal setting, dealing with stress, right? And we all have stress. So it's not that it has to be, I have some diagnosis that, or I've got some disease or issue that needs to be addressed. Like, no, this is just like you would go and exercise every week or, get out to the lake or the trails every month. Like this is something for you to do to broaden your health, your mind, your capabilities.
Yeah, I always talk about it as being one slice of the pie. It's not the whole pie, but you need to have this slice in there. It's one of the parts for men's health, right? And a lot of times men, especially in my experience, we poor mental health hygiene, typically little to no modeling in our lives. That's not always the case, but oftentimes, and there's just a low value for mental health. I won't get on my soapbox about this, but anyone who knows me professionally knows that I do often screen time. Our phones impact our mental health. Social media, how much time we spend on it. Are we reading comments? How long are we doing that? Is that how we end our day? It's a lot of blue light. It's a lot of awkward postures with our head facing down, you name it. So that was, I promise I won't get too much on my soapbox. All right, one more thing. I wear contacts. These are blue light glasses.
Mm-hmm.
Since the pandemic, we've gone virtual, right? I'm working from home almost completely. That's had a huge impact on all of our executive functions. So much. So, all right, I promise I'll keep it short. Again, coming back to the concept that providers provide, we don't get to need, and there's a lot of societal expectations. So shame. How do you our emotional metabolism is what I call it. How just like we metabolize food, just like we metabolize the sunlight in our body, and we need that. How we do or don't metabolize our emotions impacts us. It's going to affect us all, right? Our masking shame with humor or bravado, we do this very well. I do this very well. Bury ourselves in our work also. And we know from statistics, there's substance use, vices, whether it's drinking or video games, ways that we find to social media, find ways to escape, that we aren't actually addressing the things that are looming or that we know we haven't been able to talk about.
Great.
I love this slide. It's simple yet clear. So I'm just going to say them out loud because we don't hear this enough. Grant, men have insecurities. Men deserve help. Men feel things. Men need love and care.
Absolutely. How do we get started?
Oh, man. Yeah. Right? You heard me take that breath, right? Here's the thing. Like, first and foremost, how we address mental health, right? I'm saying the same things again. If we don't address those things, that's one place for us for sure to get started. Sorry about that. My screen froze here.
Oh, okay. It should come back on quickly. Don't worry about it. Is it not happening?
No.
Uh-oh.
Technical difficulties. We need that screen from the 80s.
Sorry about that, y'all.
So I do want to say, are you good?
No, it's sorry, y'all.
It's totally fine. I do want to say that I'm responding to Jeff here, men needing men. So there are a couple of comments about the poll, so a couple of people just taking exception to the poll questions, and that's totally fine, of course. I mean, we can't address everybody with one poll with 5 options on it. So it was just kind of to take the temperature in the room. And I do feel that one of the most important things is help. Like Jorge has up here, men deserve help, and Jeff says men need men. I totally agree with that. I was just commenting that my husband, when we first came out here, didn't have a lot of friends, and he very recently found a group of people, all men, and he is so much happier since he found this group of like-minded individuals, happen to be male, that he could really be friends with. And so the help button is especially hard, for sure. So asking for help is a big thing for even for women too. So that's fine. I just wanted to stall a little bit and answer some comments in here. Is it Grant's turn or is it still Jorge?
I'm back up. It back up. Thanks for the assist with the stall. And also, whoever said that comment about men need men, that's exactly it. That's why I'm happy to be here. That's why I'm glad Grant asked me to participate and to be here talking with y'all about this. So how can we get started? I often reference something one of my professors used to say pretty frequently to us. We do not work through, we continue to work with. Meaning this is a process of refinement and growth. The goal is not to work through my depression, anxiety, trauma, problems. It's about continuing to work with our growth areas, barriers, emotions, and we need each other to do that. You can do this on your own. It is not the same as doing it with accountability, with someone you trust, where you can be vulnerable and deep and honest and share, right? Just a small reminder to make sure that any goals that you set for yourself, I'm going to reference the SMART goals handout that we have for you. I think this is another handout that would be great for you to use. It's something simple, it's practical, and us therapists love our acronyms. SMART, meaning that it's specific, right? What is your goal? For example, a goal to drink more water. I will aim for 6 cups of water per day, right? That's specific. Is it measurable? How will you keep track of your progress? I will track my progress by logging how many glasses I drink each day on my phone or planner, right? Attainable. How will you achieve your goal? Make a plan. For example, keep a clear bottle with me so I can tell how much water I've had, or set an alarm to remind myself to drink a certain amount of water every 2 hours. It's, again, small, simple. We're just talking about something very basic, right? But how helpful would it be to have improved like water intake for all of us? Pretty great.
Mm-hmm.
Right? Relevant. How will this goal help you? The goal will help me to be healthier, right? For example, have more energy. It'll help my skin. There's all the positives to having more water and being well hydrated, right? And then the last one, timely. When will you achieve your goal? I will achieve my goal by July 20th, right? So it's something measurable. It's not, I do believe it's important to have short-term and long-term goals, but for the examples we're using today to get us started, we just want something measurable that's short and brief. Grant, exercise in vulnerability. Let's talk a little bit about the self-care assessment that we did. We don't have to, share the screen and share all of them, but let's talk about one of areas. Is there one that stood out to you that you're surprised by? Again, we're looking at the self-care assessment.
Yeah, those two problem areas I mentioned that I really scored the lowest in, lots of ones, were the social self-care and the spiritual self-care. So when it came to being in touch with friends or family who are far away, meeting new people, doing activities with other people, keeping in touch with old friends, this kind of thing, and just my overall social self-care was low. And the same thing with the spiritual. I'm not getting enough time in nature, not enough time meditating or praying. I'm okay with, recognizing things in my life that provide meaning, and living within my values, or at least I thought I was. I'm not necessarily doing that spiritually or socially. And the other one, just appreciating art, music, film, literature, that's impactful to me. I get, I've got young kids at home, busy career, go. It's like, the stories, same across the board. We all have our things that keep us going. And these are some of you mentioned you're really good with your professional care because it's baked into your profession. For me, this self-care is the same thing. Integrated physicians, all that's a lot of
Grant, I think you're having something going over your microphone. It was very loud for a second.
Oh, it's that. I put it over here. I'm very sorry.
All good.
Is it good now? Yeah.
I'm totally fine now.
Their assessment was screaming at us.
That's right. It's
right. But yeah, and certainly there's some areas to work on in those others, like psychological, emotional. I identified some goals, but I think those are the biggest problem areas for me.
Yeah, great. Thanks for sharing. Yeah, and like you, just to tag along to what you were saying, professionally, I wasn't too surprised. Like it's built into the programming, my licensing. I have been focusing a lot on my physical self-care, but I was still surprised that I still had a couple areas where I had to mark off I do poorly in this area. So one example that I wanted to be vulnerable and share here, just an example. Again, we're not asking you to tackle the whole page, right? We're asking for you to have a SMART goal. We're challenging you to try to create a SMART goal around one of the areas that you ranked poorly in. And for me, especially in this field, I have to say, I'm aware I don't get regular hunger cues. And so eating regularly is a huge hurdle. And I can tell you the impact of when I'm running on fumes and coffee till noon versus when I've had something, some complex sugars, something healthy put in my body to like sustain me. So there's a lot of self-care that goes into just one goal, right? Like just creating a goal around eating regularly. We're really talking about manning up, challenging ourselves to have some self-care. So that's like that. That's me sharing. Hey, here's one that I'd like to work on. I don't know, Grant, if you want to say anything else about your self-care assessment or what you would like to share about working on.
No, I was trying to think of what would be my most vulnerable thing. Really, I think the one thing I know I struggle with personally is like meeting new people. Like I have a lot of social anxiety, so just getting myself out there, introducing myself to people. I feel like I come across as like a dick because I'm quiet, right? And then like people think I don't want to talk to them, but I don't know how to get started, which sounds so dumb, right? And when I hear myself say that, but I don't even know, like, hi, I'm Grant. Like, I don't even know how to do that.
Yeah. And that's so funny. Like, and just as an example, right? Like, even how you're describing, like, it sounds so dumb. Like, such a thing that men have to do with. You're just sharing like how you feel, right? Like, but and really, if we just break it down as a task, making a goal to like intentionally introduce yourself when you find yourself feeling that like tension of like, oh, I'm socially awkward. I don't want people to think I'm a dick, but just that awareness, like that can be a goal of like the next time I think this or feel this, I'm going to make a beeline for the person that I want to introduce myself to. And I'm going to say, hi, I'm Dr. Grant Antoine, right? And I'm making it super simple, right? Maybe not the jazz hands, but that's great. Like that's a great example of that. And here's the thing, like what the one you shared and whether me like eating regularly, it requires me to tell other people, doesn't it? Like I can't really do this on my own. And yours similarly, like in social settings, having someone that you're vulnerable with that knows what you're practicing, what you're working on is good accountability for all of us. Again, back to that comment someone said in the chat, like men need men. 100% totally true. Totally true.
And by the way, Grant, Jim says hi in the chat.
All right. So
dogs, yay!
Yeah, shout out to the Diamond Dogs. If anyone's watched this show, Ted Lasso, I'm gonna be vulnerable and share something. I get jealous. If you've seen this show, these Diamond Dogs assemble. They might not resolve any issues, right? At least you're shaking your head. You've seen it, yeah.
I love it.
Yeah, and really, it's just a space where we can get together and talk. We might not resolve things, but we have a space where someone's listening and we're listening to each other. So jealous of that. I think it's great modeling of what I would hope we can move toward as men professionally and at work and in our personal lives, which that's why we're here, right? Part of manning up is taking a look at these things and being vulnerable, finding a space where we can be vulnerable and get care and be part of providing care to other men in our lives. Do I currently have a relationship that I can be vulnerable in? Where I can have real talk. If not, how can I establish this? So shout out to the Diamond Dogs and Ted Lasso. If you know what I'm talking about, you know what I'm talking about. If you don't, check it out. Yeah, so been talking a lot here, but just a few reminders. We're gonna start small. Use that SMART goals worksheet if it helps you. You may not need to use it all the time, but it's a good way to start to just keep you in track, right? So that your goals are realistic, they're attainable, they're achievable, right? They're simple, they're small. Keep it small, and that's how you like create more skills. That's how you don't try to knock out, right? Like I'm not going to knock out the whole self-care assessment list in one day, but I'm going to pick one at a time. And if you check in with me June 20th, 2025, hopefully I've marked off some of those star areas that I want to improve on, right? So again, making it simple, making it attainable. I love this. Grant put on my slide notes: hustle, don't accept barriers, and self-advocate. I love that. I mean, that's so you too, because it's true. Like this takes work. There's grit to this. It's hard. It's hard. It takes effort. It takes time, and it takes emphasis. We have to make time for what's important, what matters, right? Don't create barriers for ourselves. I can tell you all the excuses to why I don't eat regularly. They're ingrained, right? I'm sure, Grant, you have a million excuses as to why you don't approach folks in social settings very easily, right? And those are all true and they're valid. And that's something we want to change. We make a goal for it, and we pay attention to when we catch ourselves creating those barriers for ourselves, and figure out with community, with resources, how to grow, how to change those. So again, you have to find community, and of course, addressing any mental health concerns that we have.
Can I jump in here for just a second? Jorge, you were talking about it takes time. You can't address all those points, on your assessment list all right away and bam, have them done. It does take time, but you are worth it. Everybody is worth this self-time with yourself to feel better, and if you don't think that you're worth it, see if you can possibly do something to change your mind, on that, because I guarantee you there's somebody else who thinks you're worth it, for sure.
Absolutely.
Friend.
Absolutely.
Love it. I love it. Thank you, Jorge. So we're breaking through, right? We're trying to identify our own personal barriers, what's keeping us from taking that first step. We want to accept that we need to be more proactive with both our mental, emotional health and our physical health. And when it comes to our physical health, though, like, where do we begin? Going back to those numbers, we're living shorter lives with more disease. That's what we want to address in this section. So you're breaking through what's next, right? Where do I begin? I wanted to pause here for a moment. Just remember that Cleveland Clinic survey: 82% of men, they try to stay healthy to live longer for their friends and family who rely on them. Yet only 50%, only half of us, are doing what we need to do in terms of healthcare, preventative care. That's a big number. That stands out to me. You got to put your own mask on. If you're not showing up for yourself, you can't show up for others, right? And that's what this slide for me is all about. You got to secure your mask before helping others. So what do you need to do? What do you need to do to get started? We talk a lot about health span at Viome. We're real big on early detection and prevention of chronic disease, right? We want to make chronic disease optional, because really these are diseases of lifestyle. We all have our own inherent risks and our factors that influence and might push us down one path versus another. But ultimately, it's going to come down to how engaged are we with our health, and what are we doing on the day-to-day basis? And those activities, those habits, are going to help us build our health span, right? How long can we live a healthy and fulfilling life? And that's important. That's what we're here to do. Kind of the four main buckets we want to focus on in terms of health span are these four you see on the screen: metabolic, cardiovascular, neurocognitive, and cancer. Right? Metabolic, all we're talking about, blood sugars. You think obesity, diabetes, insulin resistance. We got to know our numbers. We got to check in. Cardiovascular health, our blood pressure, our cholesterol levels. Do we have plaques? Our risk assessments. We have a handout here to give you where to get started on getting a baseline on your cardiovascular risk, and some of the numbers you need to be in touch with, right? Cardiovascular disease, the #1 killer for both men and women. We need to be paying attention to this stuff if we want to live long, healthy lives. Neurocognitive, recognizing early signs. I think this is a bit like we shouldn't, like everyone think it's coming, oh, like I'm gonna forget where I left my keys. Yeah, okay. We all do that, time and time again, but these patterns, these rhythms, they shouldn't be popping up over and over and over. Forgetfulness, difficult with focus and attention. Certainly we can all have a bad night of sleep or, a night out with friends, and that's going to influence how we can think and feel and remember the next day. But like your overall trend, what's your baseline? Be paying attention. There's screening tools out there. This is a talk you can have with your provider. Come from a place, again, of vulnerability and curiosity. Like, hey, I don't know if this is normal or not, but I haven't told anybody. But like, if I don't write this stuff down on my calendar, I will absolutely forget. Like, have that conversation if that's your experience. They can talk. The providers, professionals should be able to walk you through that and doing the appropriate assessments. Cancer, this is just getting it done. Skin cancer, prostate, testicular, colon, oral cancers. You got to get those screening exams done. We'll talk a little bit more about that in a minute. And then I just want to talk about quickly lifestyle medicine versus pharmaceuticals. Both very important. There's a time and place. These are tools that we use to cultivate health, but that lifestyle, that's going to create that foundation of health that's going to serve you through the years and hopefully prevent the need for these other tools. So I'm not poo-pooing on pharmaceuticals or conventional medicine. We need those tools in our lives, but we need to be engaged and we need to be paying attention to our movement, sleep, the things you see here on your screen. This is really, I call it grandma's medicine, right? You get outside and play, eat your vegetables, go to bed on time, wake up on time. And I guess the larger issue most folks have is like, hey, how do I get started? Where can I improve? Like, where do I start? And then how do I get started? And these days, there's so many resources. We're not going to go into depth for that today, but I did want to give a little framework. If I was like, if you weren't doing anything with your health, what would I suggest for you to do? Oh yeah, thank you, Lisa. I skipped right over the mindfulness. Okay. I want to make sure for that stress management and for the lifestyle medicine, you've got that tool. It's a great starting point. But where to begin? Schedule that appointment. I don't know you. I don't know where you're at in your life. You might be all up to date on your exams, but for many, it's like you just need to schedule that appointment with your primary care provider. Maybe you've already done that. Maybe you need to get that colonoscopy done. You need to schedule that appointment. Maybe you've done all your screenings and you need to work out more. You've got some goals there that you need to accomplish. Schedule an appointment with the personal trainer. Whatever it is for you, get it on the books. Schedule that appointment. A lot of times, recently I had to get my colonoscopy and I just kept coming into barriers, just getting to get the referral for GI. It was a 6-month wait list. Once I got the referral, a 6-month wait list, like I didn't accept that. And I kept grinding and I was able to get both of those appointments within 6 weeks. Now I got that colonoscopy done. It's in the bag. I'm moving on. Don't accept no. And there's so many resources out there for you. And it's just as simple as picking up the phone and just keep calling. I know it's a grind and I hate it too, waiting on the prompts and listen to the music and talking to the robots, representative. But we got to do it. Make that appointment. Yeah. Right. I mentioned with the metabolic health and the cardiovascular health, you got to know your numbers. So this is one of the reasons about getting that appointment. If you don't have access to ordering your own labs, you got to know your numbers. Yep. Glucose, lipids, inflammation, liver and kidney health, hormones.
Another one too, Grant, the assessing your cardiovascular health, because I think it's very helpful.
Yeah, absolutely. These are numbers you need to be in touch with. And because knowledge is power, right? If you don't know, like you can't put your head in the sand. We got to know these things. Get your screening exams done. You want to catch that cancer early on, early stage. It's as simple as like cutting it out versus, a year of chemo, radiation therapy, just a nightmare. So getting started on lifestyle changes. This is where Viome comes in, right? Where we make it easy. You order a kit, you test from home, you drop your samples in the mail 2 weeks. You've got your results, as well as all of your personalized food and supplement recommendations with the dosing. A lot of you guys are already Viome customers. You got to get your retest, make sure you're engaged and you're tracking over time, right? And Naveen always says, like, you wouldn't just exercise once and say I'm done, like I'm fit. No, it's an ongoing process that we have to continue to hack at. But really, we do our best to make these changes and lay that nutritional foundation that helps prevent so many of these issues with chronic diseases. So it's really a no-brainer. And it really helps you identify those areas, your personal areas, just like the self-assessment tool, looking at those health scores, whether it's cardiovascular, neural, biological age, maybe it's your gut, but testing, you don't know until you test. Let's go to this next slide here. And so here's our little challenge, right? We've been really challenging you all morning, I suppose, but complete that self-assessment that Jorge brought in, set those SMART goals using the tool also that Jorge provided, schedule that appointment, whether it's a primary care provider, maybe you're like, hey, you know what? I do need to have some mental health support, make the appointment, order your Viome kit, get started on your dietary recommendations, your foods and supplements. If you're going to track anything, we have so many trackers and gadgets these days. If you're going to track anything, I want you to track your sleep. It's so foundational. It touches on, we look at our blood glucose, we think diet, right? But we don't think sleep. Sleep impacts your blood sugar levels. We think cardiovascular health, inflammation and blood pressure. Absolutely, sleep influences both of those. It's foundational, and we're busy, we're on the go, we're over caffeinated, we're over drinking alcohol, right? We're all social drinkers. Like we always minimize how much we drink, but all those things have an impact on our ability to rest and recover, our ability to sleep. So you want to know that, hey, I'm not just hitting my 8 hours, I'm getting 8 hours of quality sleep, because it's not just the quantity, it's that quality. And maybe you're getting 6 or 7 hours, but it's high quality sleep. And we want to make sure we're getting that time for our bodies. And then you just got to start moving, man. If you're not exercising, again, this is one of those foundational things that, like, everyone wants to live longer and they want to do it by standing in front of a red light or taking some supplement. You got to be moving, you got to be exercising when it comes to our heart, our brains, our mental, emotional health we've been talking about all day. It's a huge stress relief. You got to get started. And I don't care if it's just 5 or 10 minute walk to the end of your street after dinner. Make that goal. If this is an issue for you, I challenge you, it's every night after dinner, walk to the end of the street and back. Start there. That's something, that's movement. You're going to start enjoying that time. You're going to look forward to it. And then that snowball, it's just going to roll and grow. And now you're walking to the next street. Now you're walking around the neighborhood. Now you're getting a little jog in, whatever that is for you, whatever that looks like. There's apps out there, like, little 7-minute workout apps. If you feel you don't have any time or money to get to a gym. These days, there's so many resources. It's really up to you to find where you like and what you can fit into your schedule and enjoy, right? It just doesn't have to be hardcore. I got to lift, do my deadlifts, my powerlifting. Like, no, it could be a hobby. It could be mountain biking, getting out on the trails, whatever that is for you, swimming. Just find that thing, use that self-care assessment. It's kind of baked into that as well. Just want you guys to get out there and be the best versions of yourselves. And Jorge, man, I can't thank you enough for joining us today, providing your expertise, giving the guidance and the tools to help our men out there.
Yeah, thanks so much for having me. It was great. And good luck to all y'all. And good work.
Absolutely. We are almost at time here, so we don't have too much time for questions, but we've had some really lovely comments over in the chat. Let's see. Oh, yeah. So Lee's talking about using a CPAP machine, and he's noticed a difference in his sleep. And absolutely, I agree with that as well. It definitely helps you get that oxygen you need at night. So good on you, Lee. Awesome. I just also want to say that also, if you would like to, a last minute gift to everybody here. If you would like to try a Viome intelligence test, or if you would like to retest, if you're already a customer, I'm sure many of you are customers. I just want to extend a discount code. It's Vitality. It's, if you pop that up and if you click on that, it'll take you right to the Viome website. It'll land you on the home page, but just put a full body intelligence test in the cart, and Vitality should be automatically applied for that $100 off, because all you guys deserve it, just like I was saying. You can check that out for yourself, so you can start on Grant's challenge too, and then take that self-care assessment, check in, see how you're doing, see how one by one you can attack those parts that need a little bit of help, and reach out to people right next to you, or maybe even, you know, somebody that you don't really know. It's always really nice to smile at somebody you don't really know and say hi. Grant was saying how it's hard for him to introduce himself to people, and I get that too, but there's nothing nicer than to look at a friendly face next to you don't quite know, but they're like, hey, how are you doing today? That's nothing better than that, you know? So it's just like humanity talking to humanity. So I do want to wrap things up here. We are about at time. Jeff is still waiting for his results. You'll get them. I promise we'll get them soon, and then we'll get you on an open house call. Thank you, Grant, and thank you, Jorge. And Grant, I don't know if you mentioned this. You guys are like best friends. Did you mention that in your introduction?
I did not mention it, but it's
true.
I
love that. I heard
that's
that.
My man right there. That's my boy.
Yeah, I was like, these guys are best friends, and they're doing this presentation together. That is so awesome. Thank you all out there as well for joining us for this last hour for this information. Pass this information on. Everybody's going to get a recording link tomorrow in your email. If you want to rewatch it, if you want to show it to a friend of yours, just like, hey, I'm just going to leave this here. You can watch it. Okay. So then you can turn around and help somebody else with the information. Thank you all. Have a wonderful rest of your day. Again, thank you, Grant and Jorge. I appreciate all of your help. And
thank you, Lisa. Thank you. Thank you.
You're very, very welcome. I love doing this. It's my job, so I love it. Awesome. Thank you very much. Have a wonderful rest of your day and a beautiful weekend. All right. Bye-bye. Have a great time.
Thank you, guys.